Ever wonder how certain medications can jolt your system into action? Today, we're going to talk about a fascinating class of drugs known as analeptics and respiratory stimulants. These aren't your everyday painkillers or cold medicines, but they play a critical role in situations where every second counts. Analeptics and respiratory stimulants, as their names suggest, are designed to stimulate or revive the body's systems. Analeptics primarily work on the central nervous system, giving it a much-needed boost during cases of extreme drowsiness or unconsciousness. On the other hand, respiratory stimulants kickstart the respiratory system, ensuring that oxygen continues to flow through the body, even when things are looking grim. Now you might be thinking, wow, these drugs sound pretty powerful. And you'd be right, they encompass a broad range of medications, from caffeine, which is a mild analeptic we encounter daily, to more potent substances used in medical emergencies. However, it's essential to remember that these drugs aren't a one-size-fits-all solution, and their use must be monitored carefully to avoid potential side effects. So there you have it, a quick introduction to analeptics and respiratory stimulants. These drugs are a testament to the marvels of modern medicine, capable of giving us that critical push when we need it most. Now, let's delve deeper into how these powerful substances work. Scene script. Analeptics, as the name suggests, stimulate the mind, but how? You may wonder. Well, let's delve into the fascinating world of these mind-boosting substances to find out. Analeptics are a class of drugs that primarily stimulate the central nervous system. Picturing the central nervous system as a complex, bustling city, analeptics are like a strong cup of coffee that gets the city buzzing with energy and activity. They essentially wake up the brain, enhancing mental activity and alertness. These drugs work by influencing the neurotransmitters in our brains. Neurotransmitters are like the city's messengers, carrying information from one nerve cell to another. Analeptics increase the release of certain neurotransmitters, such as dopamine and norepinephrine, that play a key role in attention and alertness. This surge of neurotransmitters sparks a flurry of activity across the brain's neural networks, leading to heightened mental stimulation. Besides increasing wakefulness, analeptics can also counteract feelings of fatigue. Have you ever felt so tired that you can barely keep your eyes open, let alone concentrate on anything? Analeptics can help with that, making you feel more alert and less fatigued. They can be particularly useful in situations where sustained attention is needed, like during a long shift at work or an all-night study session. Additionally, these drugs can enhance focus and cognitive performance. Just as a spotlight illuminates a specific area on a stage, analeptics can help spotlight your attention on a particular task or activity. This can lead to improved concentration, better problem-solving abilities, and increased productivity. However, it's important to remember that these drugs are not a magic solution for all cognitive challenges. They have their risks and side effects, which we'll explore later on in the video. Now that we've stimulated our understanding of analeptics, let's breathe life into the topic of respiratory stimulants. We'll uncover how these substances can help us breathe more effectively and why this is crucial for our overall health and well-being. Stay tuned! Imagine having the power to control the rhythm of your breath. That's what respiratory stimulants do. Respiratory stimulants, also known as analeptics, are substances that enhance lung function by stimulating the body's respiratory centers. They act like a conductor, orchestrating the tempo and depth of our breaths. This makes them incredibly useful in managing conditions that disrupt normal breathing patterns, such as chronic obstructive pulmonary disease, or COPD, and sleep apnea. Let's delve a bit deeper into how these substances work. In conditions like COPD, the lungs struggle to expel air, causing shortness of breath. Respiratory stimulants help by increasing the rate and depth of respiration, allowing the lungs to clear out trapped air more effectively. With sleep apnea, a condition characterized by periods of interrupted breathing during sleep, these substances help by maintaining steady breathing throughout the night, promoting a more restful slumber. But it's not just about breathing easier. These stimulants also enhance oxygen delivery to the body's tissues, ensuring that every cell gets the oxygen it needs to function optimally. This can ultimately lead to improved energy levels and overall quality of life. However, as with any medication, there can be potential side effects. Some individuals may experience restlessness, nervousness, or even insomnia due to the stimulating effects of these substances. Others may have allergic reactions. It's also worth noting that these substances should not be used as a substitute for other treatments or lifestyle modifications that are essential for managing respiratory conditions. In cases where the benefits outweigh the potential side effects, respiratory stimulants can be a game changer, offering relief to those who struggle with respiratory ailments and breathing difficulties. Now that we've taken a deep breath with respiratory stimulants, let's analyze how these substances interact. When analeptics and respiratory stimulants work together, they create a symphony of stimulation. Now let's dive into this symphony and understand how these two groups of drugs interact and the potential benefits of this powerful combination in the medical field. Analeptics are drugs known for their stimulating effects on the central nervous system, particularly the brain and spinal cord. On the other hand, respiratory stimulants primarily work on the respiratory centers in the brain, enhancing the depth and rate of breathing. When these two join forces, they can bring about significant changes. Consider, for instance, the treatment of certain respiratory disorders. Some conditions might slow down or obstruct the natural rhythm of breathing. This is where our dynamic duo comes into play. By stimulating both the central nervous system and the respiratory centers, this combination can help normalize the breathing pattern, providing relief to the patient. But that's not the only area where this combination shines. It's also quite effective in counteracting the effects of sedatives and narcotics. These substances can depress the central nervous system, potentially leading to a slowed respiratory rate or even respiratory failure in severe cases. By leveraging the stimulant effects of analeptics and respiratory stimulants, healthcare providers can counterbalance these impacts, helping the patient to maintain a normal breathing pattern even under the influence of these substances. This fascinating interaction is not just about treating conditions or counteracting effects, though. It also opens the door to new possibilities in medical research and drug development. By understanding the interaction between these two types of drugs, scientists can explore new treatment options, potentially making a big difference in the lives of patients around the world. As we've seen, analeptics and respiratory stimulants can be a powerful team, but what happens when things go wrong? Stay tuned as we delve into the risks and side effects of this potent combination in our next segment. You won't want to miss it. Scene script. Every powerful tool comes with risks. What are the risks associated with analeptics and respiratory stimulants? Now, let's dive into the murky waters of potential side effects and risks that come with the use of both analeptics and respiratory stimulants. It's essential to remember that these substances are not candies to be taken lightly, but powerful tools that can significantly impact our bodies and overall health. Starting with analeptics, these stimulants, designed to stimulate the central nervous system, indeed come with their share of potential side effects. The most common ones include restlessness, nervousness, and even insomnia. In more severe cases, users may experience symptoms such as hallucinations, delirium, or convulsions. Analeptics can also lead to physical dependence and withdrawal symptoms if abruptly discontinued after long-term use. Turning our attention to respiratory stimulants, they too are not without their risks. These substances, intended to increase respiratory drive, can cause potential side effects like hypertension, tachycardia, and palpitations. In some cases, they may even lead to more serious conditions like pulmonary edema and cardiac arrhythmias. It's important to understand that these side effects aren't guaranteed. They are potential risks, and their likelihood can vary greatly depending on factors such as dosage, individual health conditions, and whether or not other medications are being taken concurrently. Moreover, these substances can interact with other medications in ways that can either increase or decrease their effectiveness, leading to potentially dangerous outcomes. Therefore, it's absolutely crucial to use these substances under the guidance of a healthcare professional who can monitor your condition and adjust your dosage as needed. In conclusion, while analeptics and respiratory stimulants can be powerful tools in the medical field, they are not without their risks and side effects. Like a double-edged sword, they can both help and harm. Thus, it's vital for us to respect their power and potential for harm. While these substances can be powerful tools, they should be used wisely and responsibly. We've taken a deep dive into the world of analeptics and respiratory stimulants today. We've explored their characteristics, how they interact, and the possible risks and side effects. Understanding these substances is essential, whether you're using them yourself or advising others in a professional setting. Remember, knowledge is power. particularly in the realm of pharmacology, so let's keep expanding our horizons together. Subscribe for more because you won't find me later. Keep learning, keep growing, and stay curious about the world of pharmacology.